Manukau District Health Board has some of the highest health needs in New Zealand today, where a third of hospital admissions are potentially avoidable, with some of the highest rates of chronic obstructive pulmonary disease, depression, heart failure, and particularly young people heart failure, cardiovascular disease and diabetes. We have an obesity epidemic which is out of control. The response from the government and from the Counties Manukau District Health Board and the local PHOs is the Chronic Care Management Programme.
The Chronic Care Management Program is probably the number one priority in terms of the DHB.
We have to find ways to work smarter, not harder.
The Chronic Care Management Program connects patients with greater networks of support. It provides additional resource to practices to better manage people at risk. It puts the patient back in charge of their own health.
So we want to prevent people from getting sick. We want to give people the tools to recognise when things are going wrong for them and to intervene early so they don't actually end up in hospital.
Patients are coached by a team of health providers, where GPs and practice nurses tap into all supporting fitness, nutrition and other networks to better health.
We've got to involve everyone in the management of their care, because often the patient with a chronic condition isn't the person who's doing the cooking.
One practice that has CCM working for them is Mangere Family Doctors.
We are involved with proactive preventative medicine. We're identifying problems early, we're doing something about it.
The program relies on the practice nurse involving themselves more in their patients' care.
How you doing?
They have this continuum of care in that they usually see the same nurse each time they come in, which helps in developing rapport.
So how you been doing?
It gives the patient and the nurse uninterrupted time to specifically talk about them and where they are at and what they need to help them move forward in caring for themselves.
Hi Georgina.
Hello, Terry.
Come on through.
Oh, thank you.
Have you seen Donna? Before the advent of the program, management of patients with chronic illness tended to be a series of crisis-initiated ad hoc consultations where we would sort out problems. Your blood pressure is really, really good.
Evidence shows that people who are involved in chronic care actually make better health outcomes.
The Chronic Care Management Program equips patients with a wellness plan to help them work towards their goals.
They're giving you an idea of how to cook, what to buy, exercise.
The wellness plan contains information about the patient's medical condition and current medications. Using the plan, the practice nurse and the GP can help patients to reach health goals like losing weight, stopping smoking or getting more active.
It's one of the tools we use to try and empower patients.
The wellness plan is a structured process to take you through a consultation with a patient to try and encourage the patient to engage, to take some control of the condition, to learn more about it and to take part in decision making with the health professional, whether that's the doctor or the nurse or the community health worker.
What we need to recognise is we're not trying to create expert patients, we're actually trying to create expert people who manage their lives with these conditions. And maybe we should be moving away from the patient concept, and maybe we should be moving more into how do we support the community to support itself.
Part of the programme is this funding for 4 GP visits through the year, spread out through the year, and also up to 6 hours of practice nurse time to see the patient, to engage the patient and to work on wellness and self-management strategies.
Health Pacifica in Central Mangere uses the Chronic Care Management Program, involving community health workers like Sully Robertson.
People like us, we know what's going on here. We are working in the field and we are the people who picked up a lot of these things. We sort of report it back to doctors
Aside from the funding we get for the program, which is in a big practice pretty significant, there's a lot of professional support.
The program extends the general practice team to include dietitians, nutritionists, physiotherapists, and amongst others, gyms and personal trainers. So, how does the CCM program support general practices?
It's well funded, it comes with a funding stream, and if you have a number of patients in your practice that qualify for this program, then you can afford to employ more staff.
One of the things we're trying to do is give general practice an opportunity to do structured care by funding that care, by providing templates and structured notes to take you through our consultation, which is evidence-based. We're giving electronic clinical decision support, which makes sure that when the patient comes to see you, they're getting the best advice possible based on the best evidence available in New Zealand today.
Counties Manukau have an IT structure that brings to desktops real-time patient information, and it allows safe sharing of that information across sectors.
People in the secondary setting at Middlemore and the Manukau Super Clinic can access information that we have on the patients, and we also have the same privilege being able to access some of the patients' notes in Middlemore through Concerto.
Software programs like Concerto assist with flow of information between all healthcare sectors.
It's absolutely essential to have the coordination occurring across care to make sure that patients don't fall between the cracks.
An enormous amount of money has been invested into some fantastic technology. This allows us to support better healthcare for the patient. In the olden days, it was reliant on clinical notes, printout of lab reports, the old x-rays on films, and there were people racing those around the hospital to get them to the right place so that information was there at the time that it was required. It also has got the benefit of cutting down unnecessary tests should patients be transferred through to another hospital for any reason.
A nurse specialist or a nurse within the practice can actually go through some of these records and say, okay, these are the people who are not doing well. Let me look at their templates. Let me see whether they've actually got a plan in the last 3 months, and they can work from that information.
Electronic clinical decision support is not replacing doctors or nurses, it's a framework, it's a support mechanism.
It gives me a bit of a structure to my consultation. We get decision support on each of the programs within 30-40 seconds within the consultation, but I now know when I do a consultation for a patient with CHF, I'm doing a world-class consultation, checking all the bases that should be checked, and if something comes up that's abnormal and I'm not sure what to do, at least I can ask intelligent questions and move forward.